IOL, for toric IOL. Now we'll see the how to perform a good surgery of toric IOL implantation. Over to Dr. Seena. She is a senior consultant, phaco and refractive surgeon at Comptos Eye Hospital.
Now we will see how to do what are the surgical techniques for a toric IOL. Once you get the patient in your OT, after the marking, just see the markings are very clear and see the dilatation. If it is a well dilated pupil, your phaco part is easy and final axis alignment of the IOL will be easier. So before marking the axis, you should know the alignment of the axis. That is, superior is always taken as 90 and left temporal is 0. Otherwise, clock hour 3 can be taken as 0. Before doing the axis marking, see the calculation sheet. Here the axis marked is 11 degree. And if there is any conjunctival ballooning, just swipe the fluid towards the fornix and clear it. And in this video you can see, take the toric dial, keep it over the limbus, align it to the reference axis 0, 180 and take the marker marked with the junction violet and keep at 11 degree. The marking will be seen clearly, and if the cornea is not dried properly, you can see smudging like this or spreading of marking, which will be giving poor visualization during your phaco. To avoid parallax, the surgeon side marking is taken as the reference. You can do this procedure with your dialer also. Before making the pots, see the calculation sheet once more. See the incision location is at temporal side, that is on the surgeon side. Here it is on 0 degree and the alignment axis is given. Better take any clock hour position other than the alignment axis for making a side port. If you make side port at the alignment position, then after hydration, the visualization of toric markings will be difficult. And always see the alignment axis is plus or minus 10 degree from the steep axis. If you are putting somewhere near the flat axis, you will be adding on the cylinder. In the calculation sheet, always verify the patient's name and the eye and the remaining IOL power, that is the toric power remaining. Here in this video, you can just make the pots just like any other case of phaco. Just only one thing to be careful, avoid the alignment axis. Rhexis is just like any other case. Do a 5 to 5.5 mm rhexis. It will be covering 1 to 1 mm of the periphery of the lens, and it will be giving a proper centration of the lens and will prevent prevent rotation for the lens. After completing the rhexis, for hydro, it's a routine hydro. You can rotate the lens. You can do the phaco procedure of your own choice, that is chop and chop, divide and conquer, or direct chop, whichever is your preferred choice. Once you complete with your phaco, you can do a complete cortical cleanup. After doing the complete cortical cleanup, you can implant the IOL either under visco or under IA. Before putting the IOL inside, you should know the systems available for torics. The first one is a Technis iHands preloaded IOL, which is the instruction will be provided by the manufacturer. The second one is Indian system, that is Suprafob toric IOL. Non-preloaded ones also are available. They are to be loaded as per the instruction provided by the manufacturer. It can be loaded just like any other monofocal IOL of the same manufacturer. Should be placed inside the cartridge as per the instruction, and the cartridge has to be fitted into the injector system, and you can check the movement of the lens by pushing the plunger. If it is moving properly, then it is ready for injection. This is a Indian system Suprafob that is loaded as per the instruction. This is not playing. Through the nozzle, saline has to be injected, and visco has to be injected through the nozzle and from behind. The flaps you can see that has to be closed by removing the central flap separator. Once it is ready, you can check the movement of the lens by pushing the plunger. For implantation, you can either proceed with a wound-assisted implantation or as normal implantation. Once it is there inside the AC, the front haptic has to be inside the bag. The back haptic, that is the trailing haptic, has to be folded and kept inside the AC. Once it is inside the bag. Once it is inside the bag, you can rotate it at the optic haptic junction with your dialer to the desired axis. This is a square plate IOL which is implanted. The leading end of the plate has to be placed inside the bag and the trailing end, let it be in the AC. And you can dial it from there to the needed axis, and after that, once you reach the needed axis, you can rotate it. You can rotate it to the needed axis, then just press it and keep inside the bag. Once it is inside the bag, just see the IOL marking is in alignment with your corneal marking. Once you complete the IOL implantation and rotation to the desired axis, next thing is the visco wash. Do it completely, and with your aspiration cannula, you can just slide the IOL to one side, and through the gap you can keep your aspiration cannula just under the IOL. Swipe under the IOL and do a complete cortical wash, complete visco wash. Once it is completely free of visco, you can just tap the center of the IOL so that it will be little bit adherent to the PC, that is bioadherence will be enhanced. For easy rotation for a C-loop IOL, you can just with your dialer you can hook at the optic haptic junction, pull slightly towards the center and rotate it to the desired axis. For a plate haptic IOL, it's better to rotate it partly when it is in the AC and partly in the bag, and once it reaches the desired axis, you can just press it and keep it inside. There's a dialing hole provided for the rotation. Once you complete this, you do a gentle port hydration without causing any further rotation to the lens. Once you complete with your toric IOL surgery, just once more you verify your axis is correct. Take the toric dial once more, keep it over the limbus in alignment with the 0180 reference marking, and check the IOL toric marking is in alignment with your corneal marking, and that is in alignment with your toric dial marking. And as described earlier, the digital system also is available very on. It will show you that this triangle is the incision location, and the alignment axis also will be shown intraoperatively and postoperatively. You can verify with this. Thank you.
Thank you, Seena, for that wonderful